All right, let's dive into a really common blood test that honestly holds some powerful clues about your health. It's called the total protein test. We're going to break down what it measures and what the results can actually reveal about what's going on inside your body. And it's a pretty wild question when you think about it. Our blood is like this incredible messenger system, constantly carrying vital information about our health. And the total protein test? Well, that's one of the best ways we can listen in on that conversation. So, to really get what this test is all about, we first have to talk about the main characters in this story, proteins. Just think of them as these tireless, unsung heroes that are keeping your body's entire operation running smoothly, 24/7. I mean, they're the absolute foundation, the building blocks of life itself. They're giving you the energy to get out of bed, they're rebuilding your muscles after a workout, and they're powering the immune system that keeps you from getting sick. They are always at work. Okay, so this test doesn't look at all the proteins. It really zooms in on two major players in the protein world. So let's get to know our main characters a little better, albumin and globulin. Let's break down their different jobs, because they're pretty different. First up, you have albumin. Think of it as the body's main transporter. It's made in your liver, and its big job is to keep fluid where it belongs, in your blood vessels, and to shuttle around crucial things like hormones and vitamins. Then you've got globulin, who I like to call the defender. It's made by your liver and your immune system, and its number one role is to fight off infections and move nutrients around. Two very different jobs, but both are absolutely vital. And all of this brings us to something called the AG ratio. See, the test isn't just about the total amount of protein you have. It's really about the balance between these two types. It compares the amount of albumin to globulin, giving your doctor a fantastic snapshot of the relationship between your body's transport system and its defense force. Understanding that balance is key. So that leads us to the next big question. Why would your doctor even order this test in the first place? Well, it's a powerful way of listening to your body's signals, whether they're just subtle signs picked up during a routine checkup or more obvious symptoms that really need a closer look. This test really plays two key roles. First, it's a proactive tool. You'll often see it included in a standard health screening, something called a comprehensive metabolic panel. But second, it's a diagnostic tool, like a detective's first clue, used to investigate specific symptoms that might be pointing to an issue with your liver, your kidneys, or even your nutrition. So what kind of symptoms are we talking about? Well, things like swelling in your feet, ankles, or belly from fluid buildup, or maybe unexplained weight loss or a fatigue that just won't go away. Other signs could be a loss of appetite, feeling nauseous, or jaundice. That's when your skin or eyes start to look yellowish. Now, if you're ever scheduled for this test, seriously, don't sweat it. The process is so simple and so fast. A healthcare professional just takes a small blood sample from a vein in your arm. Yeah, you might feel a tiny little sting, but the whole thing is usually over and done in less than 5 minutes. Okay, so we've covered the why of the test. Now for the really interesting part, the what. Once you get those results back, what could they actually mean? We're going to decode the numbers, but first, a really important reminder. I can't stress this enough. An abnormal result is not a diagnosis. It's a clue. It's a starting point that tells your doctor, hey, maybe we should look a little closer over here. It's just one single piece of a much larger puzzle. All right, let's start with your total protein number. If that number comes back low, it could suggest there's a problem with the organs that make protein, like your liver. Or it might just mean you're not getting or absorbing enough protein from your food. On the flip side, high total protein can mean your body is pumping out extra proteins, usually those defender globulins, to fight off some kind of chronic infection or inflammation. In some rare cases, it can also be a marker for certain blood cancers. Now let's look at the AG ratio, that all-important balance we talked about. This adds a whole other layer of detail. A low ratio often happens when your body is making too many globulins, or not enough albumin. This could be a sign of an autoimmune disease, where the immune system is working overtime, or it might point to liver or kidney disease. A high ratio is way less common, but it might be linked to some genetic issues or certain types of leukemia. And I've got to say it one more time, these are just possibilities. No single number ever tells the whole story. Your healthcare provider is going to look at these results along with your symptoms, your medical history, and probably other tests to get the full, complete picture. So, with all these clues and all this context, how does it all fit together? Well, it's absolutely essential to see this test for exactly what it is. One snapshot in time, just one single part of your larger health story. At the end of the day, this test is an opportunity. It's a data point. It's a perfect starting point for a really valuable, informed conversation with your doctor about what's going on inside your body and, most importantly, how you can best support your overall health moving forward. So, we'll leave you with this thought. Your body is always communicating through symptoms, through how you feel, and through the data hidden in your blood. This test is just one powerful way to listen.